Welcome. Quote Me on That podcast is an initiative of Quote This Woman Plus. Quote This Woman Plus, also referred to as QW Plus, is a gender justice organization that links women plus experts to the media. Quote Me on That introduces our women plus experts to the world.
Hi, and welcome to Quote Me on That. This is an episode where we have a phenomenal guest. We'll be talking about public health and equity in public health. So today's guest is Dr. Atiya Mosam. She's a physician, a policy expert, and a passionate advocate who refuses to separate science from equity. Atiya challenges the comfortable, speaks truth to systems, and brings it all back to the people. Let's lean in, and it's time to rethink what health equity really means to the masses. Welcome, Atiya.
Thank you, Renee. Thanks for having me.
So we're joined by Dr. Atiya Mosam, and we're going to be wanting to understand who you are and why you do what you do. So we really would like to know your backstory in terms of, how you got into public health, but then also what's kept you there.
Thanks, Renee. So I began as a medical doctor, went through medical school, kind of having an understanding of medicine, but not really, even though, we are exposed to the hospitals and the social determinants and, the struggles of the everyday South Africans that we are meant to serve. But when I got into my internship years at Baragwanath, when you're a student, you're focused on being a student. And when I got into my internship years at Barag, I remember quite strongly, I was in a ward and I was seeing a little boy whose leg was in a traction. He needed to be in hospital for 6 weeks. And um, there was a lady standing beside him. She was doing math. And so I said to her, just out of curiosity, sorry, what are you doing? And she said, no, I'm one of the teachers on the grounds of the hospital. We have a school because we come and teach kids who are in hospital for a long time. And for me, that I was just like, oh wow, that's something I had not thought about. I had not thought about the implications of a child being, in school for a long time. And so so between that and a few other, this was back in 2000 and between 2007 and 2009, and we had like the xenophobic attacks, where I started working with Gifters Are Givers and Medicine Sans Frontiers around, helping people who were displaced. And that got me thinking a little bit more around like health and equity and, health management and the like. And so that's when I decided to try and move towards public health. I was very fortunate as a community service doctor to be placed in the primary healthcare facilities in Soweto, and so you see everything, all of the burdens of disease. You see all of the social determinants, and I worked both in clinical management and in seeing patients, and in public health at the time. And so that's really started my journey and started my thinking around how better we can strengthen our health systems to achieve what we really wanted, which is good quality care and equity for everyone.
Thank you so much for sharing that. I can only imagine. I mean, there's so many health practitioners that don't think about all of those elements. You still need to be educated. You still need access to the one or the other thing, and yet we don't see it. And that's amazing that you actually met this person, and that this does exist. So it's also a very heartwarming story because someone didn't miss that, the fact that education was needed. But it's a nice learning curve, and something that kind of opens your view on just someone laying in a hospital and what they still need. I've been lucky. I think I work with a TB hospital in Cape Town, and I've seen the same thing there, where they have a school. So I've been working with their school quite a lot in terms, and they thinking about sustainability and food. And so it's amazing, that we do need people who are thinking way broader than just, I'm coming today to see my clients. So I think on that note, because you spoke about the social determinants of health, and you spoke about in like access really. So it brings me to equity, because a lot of the work that you do is around that. How would you define equity in public health?
So, I think no one watching this would be surprised to know that South Africa is the most inequitous country in the world.
Yeah.
And it feels like that gap is widening. Day by day, it seems like it's not getting better. I think in terms of equity in South Africa, it's tied into a lot of things. It's tied into writing our past, tied into shifting, the balance of power, the balance of who has access to services, who has access to good quality services, who is not put under financial hardship in accessing those services. So there's a lot that needs to be addressed in terms of achieving that equity in South Africa. And we know the health system is trying hard. We know there's a lot of endeavors underway, but the system really is, especially the public health system at the moment, is crumbling on the one side. And on the other side, we've got, the private sector, which is really inequitous in terms of who it serves, somewhat inefficient in the costs around it. And so we've really gotten to a point where these are so far apart. We've got, one system serving a large majority of the population, really strained. And then we've got another system which, has been unregulated and is serving a smaller part of the population and is, I'm not going to say that they are, not delivering good quality care, but we actually don't know what level of quality care they are delivering. So it seems like we are moving further and further apart, and there needs to be some measures around bringing them together so that everyone has access to the same, or to what is needed, which is, what they need, which is the definition of equity, giving people what they need and not the same for everyone.
Yeah. So tell me, in terms of equity and the work that you do, and we're talking about health systems, and especially like you've just painted the picture about the inequities between public and private sectors. What, in your opinion, do you think would be an answer or a solution towards that, driving towards equity? What would help that?
So, from the public sector point of view, I think, massive changes need to be made in terms of the facilities that we have, the number of healthcare workers that we have. We know there's a huge inequity in terms of distribution between not only the private and public sector, but the urban and rural divide, which is, that happens all across the world, right? But so that doesn't mean we don't need to address it. We need to stop the corruption that is happening. The health sector is bleeding money. We need to be able to deliver the services and get the resources that we need. So that's the public sector. The private sector, on the other hand, we have escalating costs. We don't know what quality of care we need to. We are receiving from the private sector. So I think in terms of achieving equity, we need some sort of model of bringing both platforms together.
Yeah.
The NHI is aiming to achieve this. I know everyone has really strong feelings, either one way or the other on the NHI. It's not a silver bullet. It's going to take many, many years of really sound technical thinking around how do you increase access to the general population, to the private sector, who pays for it, but how do you ensure that everyone is remunerated fairly, whether it's your nurse on the ground, your community healthcare worker, etc. How do these practitioners work together? If you are referring from a community healthcare worker to a private GP, how does that work? It's going to take a lot of work to do, but I believe it can be done. We need a lot of willing people across society, not just the health sector. I
Yeah.
mean, this involves quite a few, we always talk about health in all policies and multi-sectoral approaches. We're going to need everyone to kind of pull their weight. So I think, yeah, it's going to take a long time, but we've got to start somewhere.
No, absolutely. I can't agree with you more. We definitely need to start somewhere. I have been doing a little exercise.
I believe that some community sensitization at the ground level was done, but it was done around election time.
Mm-hmm.
And it was done in a very political manner. I don't think it has been done in a way where we have the voices of communities helping us design
Here we go.
what is needed, firstly. And then if we broaden community or we broaden population, the populations that we need to address, the one population is the healthcare workers. And I don't feel that this has filtered. I know, government has done a huge campaign around NHI. There's all of these, videos that they have around what it is. But if you are in a rural community, or forget even rural, whether you're a nurse in Soweto, for example, or you are a GP, or a specialist, or community health worker, you have no sense of, and I know they're still designing it, but people don't understand when we talk about things like capitation and fee for service and changing the models of care. Like, people need to know what that practically means for them. And so what I've been trying to do is engaging with colleagues that are not public health people, to go through what the understanding is around it, explain the public health perspective of why do we need to change the financing system? Why is fee for service not good? Why do we need to move towards prevention and health promotion? These are things that are like sort of like easy things for a public health person to talk about, but it's not in the everyday vocabulary of many of the health workforce, right? So I think that needs to be done. I think there's the engagement with communities around, okay, what does actual equitable healthcare access mean for you and your community? But then also with the healthcare workers around, well, how does this impact you? I mean, everyone thought that they were going to wake up, after President Ramaphosa signed, that they're going to wake up the next day and not have medical aid.
Yeah, true.
Or like all of the doctors in the private sector wouldn't have like patients or whatever it is. So I do think, conversations, and I use that word deliberately, conversations. We know that people are antagonistic usually about things that they don't understand well.
Yeah.
And so, we need to have those conversations with them. And I think I've been seeing from, different colleagues that that's what they've been doing. They've been advocating in their spaces, but being very fair around, we do understand that there's concerns. We're not here to say that this is a silver bullet. These are potential gaps, these are potential downfalls, but we want to just, we need to address the inequity in the country. This is the model that's been chosen, and the way that we can ensure that it is robust is by engaging. If we all sit there and then just let whoever is interested do what they want to do, then you can't be unhappy with the outcomes of the system.
Absolutely. I think that was my point, is that there are people that know and people that we just haven't reached yet. And so we do have a lot more work to do, because when people sit with their mouths open and go, what are you talking about? It's like, come again? I do know about the activities that have gone on. I've been part of them as well. And I also have had to sit back and think, is what I'm doing right? How can I do it differently? And I agree with you. It is about conversation. We've had, I think, two not workshops, but discussions last year, which was really helpful. But again, it didn't reach, the numbers of people that you want. You want to have these, in my mind, I can see these two women talking over a wall, asking each other, do you know? Do you know? Because then I feel we've won, if I'm having my cup of coffee with my neighbor over the wall and going, oh, do you know about NHI and how is this going to affect me? And I think that's the thing that bothers me, is that people don't know what does it mean for me. You're totally right when you say when the bill was signed, it was like everyone thought, okay, doctors need to pack their bags, they need to go find work abroad. We're not going to have doctors. What's going to happen? So it's a very real thing. People are reacting, and there's obviously a lot of myths around these conversations. And I think it's difficult conversations as well, because you can't really speak about equity and moving towards equity without speaking about the past. And I think that's important, is that people don't understand that's where it comes from. When I have conversations with people, then they'd ask, but why? But why? And when you go back, they're like, but we're not there anymore.
Yeah.
They don't seem to understand. Like you rightfully said, the gap is just growing bigger and bigger. It's not actually being plugged. So yeah, or being bridged. So yeah, thank you so much for that. Then what does it look like to be a physician or and move into the policy space? Do you still see clients? How does that work?
So I don't see patients any longer. I am mostly working behind my computer. I was having a conversation with a colleague the other day. What were we talking about? And I said to her, we were talking about something very, like, completely out of like the gamut of medicine or anything. And I said to her, did you ever think in medical school? She's also a public health surgeon.
Yeah.
I like, did you ever think in medical school we'll be having these conversations? Because it's really far, it's sort of far removed from like the everyday clinical work that you do, but it's obviously within health. And I remember one of my colleagues, when I just started specializing in public health, we were sitting in the hospital and they were discussing like the boiler room. And she's like, did you ever think you'd be discussing the boiler room? I was like, no. But yeah, so I think, there are times when you miss the sort of the immediate gratification of seeing someone get well.
Yeah.
This is quite removed. You are doing things that you may never see come to be. Maybe like you'll have a journal article that you'll write that you will see. But like the rest of it, like, that you may never see the impact of this policy in your lifetime, or you may never see, the people who are impacted on a day-to-day basis. So it can feel very far removed. And sometimes I have to stop and remind myself, like, who, because when you don't see the sick person in the bed, and you're not out there, walking around Soweto and seeing the social determinants, or people's day-to-day lives, it can be quite jarring sometimes, because you're like, oh, hold on, like, I'm not just busy like typing words on a paper. At the end of the day, there's someone who is the recipient of this. And it landed for me quite a bit when we launched the South African National Strategic Plan on non-communicable diseases.
Yeah.
I was the technical writer for the National Department of Health on this, and so we launched it in the Eastern Cape. And because it was a launch, they had invited the community, and there was WHO was there, and the deputy minister was there, and everyone was talking about this thing. And I looked to the right-hand side, and there were these gentlemen who they had brought from the community, like in their blue overalls. They had clearly brought them from either like work or something. And I thought, I wonder if these people know. Like, I know he's sitting here talking about this policy, but do they know what the impact of this will be on their lives? Like, these are the people this policy is for. But it was so jarring for me, because I was like, we're sitting here and talking in like a lot of jargon,
Yes,
NCDs and
absolutely.
like SDGs and everything, and I was like, hey, we all talking English. Is English their first language? Do they understand what we are talking about? It was just, for me, that moment. And I always think about when I'm doing like high level policy work, like those are the people. And just to keep that in the back of your mind, because you don't you can get very far removed
Yeah.
from the people on the ground. Yeah.
No, fantastic. Thank you. That is so true. You know, when you think about translating policy, I remember I was busy with quality assurance for the municipality. And at some point I had a manager that said to me, here's all the policies. You're going to know them all, read them and simplify them. And every month I had to send the clinics this, 2-pager,
Mm,
3-pager of all the policies because people were just not reading it. They knew it was there,
mm,
but it was just so big and so, like you're saying, far removed. You're not seeing the what would happen is if something happened now that you needed that policy, then you go and run. But now you've got all these pages to go through
yeah.
to figure it out, right? So we came up with that model. Not sure exactly how you're making me think now to go back and ask, was that helpful? Because it was just taking the language and making it simpler and
Mm,
saying this is the summary, this is what it's about, this is what you need to look out for. And I think that we don't do enough of that for our communities.
mm,
We do of it. I mean, there's a lot of beautiful examples of policy being translated in a way that people can understand. But I think we need to be more mindful as we go
mm,
along, that yes, we write the policy for the person, we know who it's intended for, but then the end user, how does that look like for them?
mm.
Um,
Yeah.
Something as simple as a complaints procedure in a clinic. We've
Yeah.
got beautiful posters, we have SMS this, we have got whatever.
No one reads posters.
No one reads it. No one reads it. They sit there, they moan, and when you walk past and go, but you can send an SMS to this number, they look at you like,
Yeah.
why are you telling me that? I'm like, because that's how you're going to create change, is if someone
Yeah.
actually knows. But again,
Yeah.
it's like finding that sweet spot. What is it that our community needs from us to kind of bridge that
Hmm.
gap? So I think we
Yeah.
need to have more conversations with them, really. So I'm moving on now. What gives you hope at the moment in terms of health activism or health policy? What is a glimmer for you?
So I think, and I know sometimes I wonder, like, am I just in an echo chamber? Do I need to go and engage with other people? Because, I on a day-to-day basis, you engage with all of these people who are, wanting to make this world a better place. Like, it's actually quite jarring when you do come across someone who's like this, like, firm capitalist and they're only worried about like money. Um, but it's, I think it's so, like, I find myself so fortunate that I get to engage every day with people who are like really trying to fix a system and to bring about, spend their lives basically making, something better for everyone else. And I think we've all realized that we are not in our individual capacities going to change the world,
Yeah,
but we can change, just our little in our sphere of influence. And it's really, really heartwarming to see that, there's so much drive by so many people to try and make things better. So I think that gives me hope. When COVID, you know, sprang up in 2020, as much as it was so, terrifying for many people, healthcare workers, you know, governments, etc., um, there was also the sense of people coming together and camaraderie and like support, and that is as terrible as the sort of geopolitical and the development world in recent months has been in terms of like the withdrawal of funding, etc. That same sort of upspringing of people coming together it was very reminiscent of COVID for me. Um, and that just reminded me that there are like people who are really dedicated to doing this type of work and will continue even in the face of, whatever, whether it's geopolitical or microbacterial or whatever comes our way. There are people who are really striving to make this world a better place. And that's what gives me like hope and sort of the courage to continue every day.
oh, that's amazing. I can totally agree with you. When I think of COVID, yes, there's the devastation, but there's that part. that I think even healthcare workers, the respect for healthcare workers, the unity within community families, and households. There was much more of that, and I think it's interesting to see how time has passed and how some of that has left us again. We've forgotten that we've been in that space. And you're right. What's happened earlier this year kind of shook us in the same way. Just without all the do this, do that, all of that. Wear a mask.
Stay in your house.
Without that, without all of that. But also very devastating. So yeah, thank you for sharing that. I am going to move on now. I wanted to know, in terms of young leaders, and so this is now completely going, it's still part of the work, but what is something that you think young health leaders should challenge and not just kind of accept or inherit?
So this is very interesting because I'm the alumni chair for the Young Physician Leaders of it's a global organization under Inter Academy Partners, and so some of these are the discussions that I have with my colleagues. And I think, firstly, I want to say, I'm also wondering at what point you're not a young leader anymore when you transition out of being young. I've got gray hair, so I don't know about the young any longer. So I think, I think it's a little bit of both. I think it's firstly learning or at least understanding how we got to where we got. And giving some grace to the leaders that came before us. No one really gives you a playbook that says a leader does X, Y, Z. I mean, it's now they are, you can go do courses and all of that to learn to be a more effective leader, but it is quite, a difficult path. So I think learning from, our wise elders, learning, kind of understanding what went wrong and what they did well. But then I think, not accepting that just because something was done X way is the way it needs to be done all the time. I think there's a value, and I know there's a lot of organizations that are talking now about intergenerational. I know one of the organizations that I'm on the board for, Common Purpose, which is a leader South African organization that deals with leadership. There's a lot of talk about intergenerational leadership, where you have like the energy and the ideas and the sort of exposure to like the new world and technology and AI coming from the younger generations, and then you have sort of the wisdom and the history and the memory of your older generations, and you bring that together to kind of forge a way forward. So I think there is a lot to be said for like learning from the past and trying to innovate the future. And I don't think that there's any one cohort that is doing it better. I think we need to bring them together to say, well, what's the best way to take something forward?
I love that. I absolutely love that, because very, very often you're like, oh no, out of the old, in with new thoughts and new innovation, but you forget the old was young ones before, and they've tried some of these things, and they know what they've gone through. And yes, times change, but there's always wisdom in sharing, among generations. So intergenerational sharing is absolutely amazing. And then the other thing that made me laugh when you were saying it, I remember I was managing a facility, and I had a client come in, or community member come in, and he was disgruntled about something, but somewhere in the conversation, those were his words, like, just because it's been working all the time doesn't mean, and that was actually a point that changed everything for me, because I was sitting there, young manager, going, but the thing works, like, why are you disrupting this? And when he said that to me, And the other thing he said was, just because it works for you doesn't mean it works for the community, you know? And that was really a changing point for me as well. So listen to the community and not just thinking, oh, this is a well-oiled machine, we know what we're doing. You might know what you're doing for yourself and for your team, but maybe not for the people who you are serving.
Yeah.
So I think you brought that to mind as well. And again, bringing full circle with your conversation. So it's a conversation with the community. It's the service that we're rendering still a good one. Earlier, you spoke about not knowing whether that service is good or not. So that's one way. I mean, I know that there are assessments, there are ratings that you can look at, but I've also got my own feelings about that. But having a conversation and knowing from your community whether they're happy or not, I think that's the most important thing. And then, of course, bringing them onto the same page in terms of what a policy means. Like sometimes people think, oh, but you can just give me this thing, like this is what I'm here for. But you are held by policy and procedure. And so sharing that policy and procedure is also useful. Yeah, thank you so much for sharing that. And we are now on to our last question. So if listeners walked away with one idea or one action today, what would that be, or what should that be?
So there's one thing that I it's a quote from, or like a saying from one of my professors from when I was a medical student. So anyone who was at Barrow will probably know Prof. Bloomson. And he used to, anytime you would walk away from him, he would say, whatever you do, do it well. So, and for me, that's always like, no matter who you are in this world, no matter what you are, whether you are, I don't know, cleaning cars, or whether you are writing a policy, or whether you are looking after your baby, whatever it is, it's just that idea of like, just do what you are doing well, and everything else will take care of itself. So I think for me, that is it. Like there's lot, like we all have a place, we all contribute in this world. The most you can do is ensure that what you have influence over, you can do it to the best of your ability.
Thank you so much. And on that note, that was Dr. Atiya Mosam reminding us that public health is not just about data and systems, it's about dignity, equity, and deep community or human connection. So thank you so much for that. And if Atiya's insights has resonated with you, please share this episode, tag a change maker, and follow us. Until next time, keep listening, keep learning, and keep quoting Women Plus. Thank you.
Thanks, Renee.